Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hello, and thanks for joining me again. Today's question talks about neck, shoulder, arm, and maybe even like carpal tunnel issues. So going to a chiropractor, is there any benefit if I'm having pain like behind my neck and shoulder area, going through my shoulder blade, maybe down my arm, all the way down to my fingertips? And the answer to that is lots of people have come to the chiropractor with these symptoms and gotten a chiropractic adjustment and have received relief. Now, how does this all work? There's a couple different things. So let's talk about a little bit about the anatomy and a little bit about what you should expect of the chiropractor and what your care plan and treatment should look like. Well, the first thing is there's a bunch of nerves that come out of the base of your neck, C5, 6, 7. And these nerves form a brachial plexus, really called the brachial plexus, that goes down your arm. It's like the sciatic nerve down your lower back. You know how your lower bones in your lower back, the nerves come out, they form one big thick nerve like your thumb called the sciatic nerve, and goes all the way down your leg and affects anything from your lower back down your leg, back of your thigh, your knee, everything down on the floor. The same thing is similar for your upper extremity, except for it doesn't form one big nerve. It forms like a web of nerves, and that's called the brachial plexus. And what it does is it travels through the neck, behind this median scalene muscle, down your shoulder, all the way down your elbow to your fingertips. And when we have problems in the neck, it can affect the brachial plexus, just like we have problems in the lower back can affect the lumbar spine. Very similar concepts, two very different pieces of anatomy though. Obviously one's in your lower back and one's coming from your neck. So if you're having pain, or sometimes I describe it like a knuckle from the inside trying to dig its way out between your shoulder blades, or if you're having tingling or maybe some carpal tunnel like symptoms, and you don't know whether or not you should go see a chiropractor, you want to go in and describe the symptoms to your chiropractor. Now, if you came to my office, I would definitely take x-rays. The x-rays would be very revealing whether or not the chiropractic care could play a role in your recovery. We would look at two different things in your x-rays. The first x-ray we would take is from the side, sideways view of your neck. Now, when we take this x-ray, we don't like to give you lots of instructions. We just tell you to stand there. We're trying to catch you in your most natural posture. I always tease in a very unnatural environment, sitting in an x-ray room. But we want to see what your neck does as you're just sitting there. So we have you stand there, take your picture. Then we have you turn around and face us, and we take an x-ray front to back. We usually have you open your mouth or close your mouth depending on what we're trying to see. Your teeth can hide the bones where your neck are, so we have you open your mouth so we can see behind your teeth. Then we have you close them so we can see down below. Then we'll take you to the room and we're going to look at these x-rays. Now when we look at these x-rays, we're looking for a couple of things. The first one is we're looking at your posture. How is your posture? Your neck is supposed to have a nice round curve to it. This nice round curve actually distributes the weight among all the vertebrae. When you lose your posture, or if you have a straight neck, then all the weight's coming straight down on the bottom vertebrae. This will create a lot of pressure on the bottom vertebrae and can also create a loss of disc height over time. Now the hole where the nerve comes out, half of that size of that hole is determined by your disc height. So if you have no posture and all the weight's crashing down, then that hole is going to get smaller and smaller, and that nerve's going to suffer more and more. And those are the nerves again that make up the brachial plexus, which goes down your arm into your fingertips. So losing your posture is a major factor in what we're talking about. Not only that, but if you have what we call forward head posture, where your heads come out forward, now you're asking those not only to take all the weight, but also asking them to work overtime to hold everything, and those muscles can start becoming a factor in this equation. Now, the muscle I mentioned earlier, the median scalene muscle, is right here in your neck. And if that neck's forward out like this, what we call forward head posture, then that muscle is being tight and inflamed and irritated all the time. And inflamed, irritated, tight muscles get sticky. And that brachial plexus will stick to that muscle, and that'll start to affect how that muscle behaves and how those nerves behave even more. Now, a lot of times I talk about carrying a bowling ball in the back of your hand like this. You can carry it with a nice arch, like a server carries a tray of food out to your table, compared to holding it straight out in front of you. You can hold that with the arch and this curve in your arm a lot longer than you can with it straight out in front of you. So for every inch forward your head comes with the forward head posture, the research shows us it's 10 pounds more force coming down. So now you also have fatigue factors. Fatigue from just doing nothing. Just fatigue from just standing, just being. And that starts to weigh more and more. Now, how do we get this posture issues? Well, we get it from sitting down. As soon as we sit down, our head goes forward and our shoulders roll forward. If you put a keyboard in front of us, it's worse. People say, what if I'm standing up at a desk? Keyboard still in front of you, it's still worse. I always tease there's no right way to eat a Snickers bar. Whenever you're typing, you're irritating it. Now, there's better ways, right? Standing up does make your lower back better and move around a little bit more. You're more likely to push away and stretch more because you're not stuck to a chair. So standing desks are better than sitting desks, but they are not the solution. Another factor in this is driving a car, reading a book, using your tablet, using your phone. These are all things that make us roll our shoulders forward. I just had to get the tools out and fix something here at the clinic. The whole time I was hunched over, shoulders rolled forward, head forward. That's just part of it. Even ironically, giving chiropractic adjustments, we're hunched over in that position quite a bit. So this is a position that we all catch ourselves in. And your chiropractor's x-ray, the lateral view, the sideways view of your neck would tell us where you are on this spectrum as far as having this posture, good posture, bad posture. Now, I tell a lot of people the best way to combat this is to retract your chin and squeeze your shoulder blades together and count to 10. And that helps do the opposite action. Especially whenever you get that urge to pull your elbow across your chest and stretch it. That's counterintuitive because everything you're doing is that. So you actually want to pull backwards more and more. And this will be tough at first if you got really bad posture because your muscles are probably actually shortened in the front side. It's going to take some time to get it back. But it requires constant maintenance, just like I have to brush my teeth every day, no matter how good I brushed them the day before. I got to brush them again because I'm going to go back to doing the same posture again. Now, could you just do that stretch and make it go away? It's better to see the chiropractor first because they can unlock your neck. Because for the second part of the equation, we took a second x-ray too. Remember, front to back? Now we're looking for what we call vertebral subluxations. And what a vertebral subluxation is when one or two bones misalign in your spine and they create stress. And then that stress hits the nerves leaving the spine, and that stress goes to wherever those nerves are going. In this case, we're talking about the ones going down your arm into your shoulder into your fingertips. So if you have a subluxation or misalignment there, which we would see on the front to back x-ray, what we call the A to P x-ray, we would see that misalignment, and that would give us a huge clue. We better examine that area for subluxation in more depth. The x-ray is not the be-all, tell-all, but it's a huge component of telling us what's going on. So then we have to make the chiropractic adjustments. Now you wouldn't want to start doing the stretch while you're misaligned, because then you start learning that misalignment better, and that misalignment can actually become more fixated. You want to get the adjustments first and then start doing the stretching. You don't want to just replace the tires and fix the alignment. You want to fix the alignment, then repair the tires on your car. So there's an order to this. So the chiropractor will look at those bones in your neck that are misaligned and give chiropractic adjustments to the lower cervical spine. Now, for every yin, there's a yang. So usually if you have one in your lower neck going this way, you probably have one in the upper neck going that way, which is why it is important to always x-ray the whole spine, see the whole image. Because if your eyes always have to stay level at the horizon. Many of you have listened to my podcast. I've talked about this 1,000 times. It's all called the righting reflex, like left and right, R-I-G-H-T-I-N-G, the righting reflex. So you have to keep your eyes level at all times. So if my neck and my lower neck's doing this, somewhere else is going to straighten me out, and I'm going to stand like this. And that's how the righting reflex works. That's why it's important to look at the whole spine, in my opinion. So we usually find one or two spots in your neck will give you adjustments. Now, if you came to my office, I already said you had the x-rays taken. We would do some chiropractic exams. A simple exam for this one is we just have you lay face down and we have you turn your head to the left and the right. At the base of your neck is fixated or subluxated, then what will happen is your whole feet length will change and we'll see big changes in you. Then we know that's locked and fixated along with the x-ray findings. We would give you chiropractic adjustments to this. Usually anywhere from 2 to 4 times a week when you first start, depending on you, depending on how bad this is, if there's arthritis in there, degeneration in there, how did this look, how bad is your posture. There's no cookie cutter answer how many visits it's going to take until we actually start examining you and working with you. The doctor should give you a report of findings at that time, basically a care plan saying, I think it's going to take X number of visits at this frequency, then we want to do this and go at this frequency, and then this frequency. In my office, you can expect anywhere between 2 to 4 times a week. Then we'd back off to once a week once we see that you're starting to hold your adjustment, meaning that you come in, you turn your head, and your feet length aren't really moving that much anymore. You're starting to get that motion back. Once that motion has been returned, then we want to introduce some simple stretching and exercises and lifestyle changes in order to help prevent this from coming again. Now, we can see you forever 3 times a week if you don't want to do them, but we don't want to do that and you don't want to do that. So I'm going to teach you how to keep it from coming back. So I'm going to teach you how to keep it from coming back. Then once we teach you how to keep it from coming back, then we'll decrease your frequency even more, and we'll see how you hold and maintain your adjustments. Again, the numbers on these are going to be vary from person to person, activity to activity, and lifestyle to lifestyle. If you're super healthy, you have very little chemical, physical, and emotional stress, we're probably not going to need to see you a lot. If you have lots of the other, we're probably going to need to see you more. If you eat lots of junk food, you have to see your dentist more regularly. If you don't eat a lot of junk food, you can see your dentist less. There's no black and white number on these visits, but you should expect a decrease in frequency and increase of extra activity to do on your own as your care plan goes along. So I hope I answered your question about whether or not chiropractic can help with what we call brachial radiculitis. Some people talk about carpal tunnel, elbow pain, shoulder pain, or maybe just that really annoying pain behind your shoulder going into your trap muscle. A lot of people describe like a knuckle digging in there from the inside. Stuff we see in the office every day. So if you have these issues, make sure you find yourself a chiropractor. And remember, there's no reason to ask your medical doctor, your physical therapist, your orthopedic doctor, your dentist, your optometrist, or even the guy that cuts your hair, whether or not chiropractor can help you. You should always just ask a chiropractor. We are the ones with the chiropractic education. I've seen the education the rest of them get about chiropractic, and it doesn't really exist. So check with your chiropractor first. Or if you have a question you'd like me to answer it, leave a message or a comment below where you're watching, listening, or hearing this, and I will make sure that I answer your question here in the next couple episodes. Thank you for tuning in, and look forward to seeing you again.